Okay, let me go ahead and try to pull up the PowerPoint where we left off yesterday. I'll go ahead and just mute. Again, I see some more people bopped in. Make sure you type here. If you've already done that, you are good. Okay, let me get my chat screen in the right spot. Okay, I'll just go ahead and mute everybody. Again, unmute if you have a question or type it in the chat screen. I left off here. We were talking about the autonomic, sorry, my glasses. I was talking about the autonomic nervous system. And when we talk about this, again, if there's divisions of the nervous system, we talk about, there's obviously CNS and PNS, but then we talk about the control divisions. You have somatic, which I didn't stress a lot. That's really the control of your body. Your muscles, which is under conscious or voluntary control. If I ever say conscious, I mean voluntary. So you can voluntarily do what you want to do. But if we have automatic body functions, that's our autonomic system, which is sympathetic and parasympathetic. Anytime there is a sympathetic reaction, there is a corresponding parasympathetic response. So if sympathetic does one thing, typically parasympathetic is going to do the opposite, okay? Parasympathetic is rest and restore, or it brings our body back to a resting state. But anytime you're under sympathetic stimulation, your body is typically using more oxygen, is creating more blood supply to your muscles, using glucose for energy. And when you're out of that sympathetic stimulation, you got to bring the body back and resupply it. You have to basically replenish everything that you've used. So what I want to bring up here is these are basically, this is a chart of things that happen in sympathetic stimulation, parasympathetic stimulation. The ones that you need to know for the test is what happens to, and I'll type it in here in a second, heart rate, force of contraction, diameter of bronchioles. Those are the tubes in your lungs. Those are basically the airways in your lungs, or your bronchioles. And then what happens to the pupil, and basically GI motility. So basically the first the first 5 things on that chart, you'll need to know what happens in sympathetic stimulation and parasympathetic. So basically, if you, and the way I think of it, now this could be a dog that the doorbell rings, and you know how your dog will be sleeping and it jumps up and it's, you know, the dog's on guard. It could be, you know, just a simple delivery, but, you know, something triggered an initial stress response. This could be a dog fight. For us, it could be someone jumping out at you around the corner. If it creates a sympathetic stimulation, you're ready to fight. The first thing it does is your heart rate typically increases. So if I ask you which division of the nervous system increases your heart rate, you would tell me the sympathetic nervous system. Okay. Now, force of contraction is how hard is your heart beating. If you're just sitting on the couch, watching TV, you're sleeping, whatever, your heart is beating, but it's not necessarily pumping. But you can tell if someone says, wow, you scared me, my heart is beating out of my chest. It's because when you are under sympathetic stimulation, your heart is going to beat faster and it's going to beat harder, because what it's doing is trying to pump blood to the muscles, to the body, to prepare you for sympathetic stimulation. Now, obviously, our bronchioles are little tubes inside our lungs. You have a trachea, it splits to the right and left sides of your lungs, and then inside your lungs are tiny little tubes called bronchioles. When you are in fight and flight, those bronchioles are going to dilate, because the interpretation is you are going to be running, fighting, your body's going to need to bring in more oxygen. Okay, so those airways are going to open up and they're going to dilate. So you're going to get increased bronchioles so the body can get more oxygen. Your pupil is going to dilate because in fight and flight, the body wants to make sure it can open up and accommodate as much light as possible to be seen. Now, the one thing that does slow down when you are in fight and flight, typically blood flow and movement to our GI tract, which is passive, typically slows down, okay? Then look at, and the next one is diameter of skin vessels decreases. Blood vessels to the kidney decrease. When you are in fight and flight, the body is going to, it needs as much blood supply, okay? And what they're basically saying is GI, kidneys, you are second fiddle. Right now, I need every available blood or all available blood to be shifted to the lungs, the heart, the muscles. So during fight and flight, temporarily, you get a slowdown in GI motility, blood flow to the kidneys, so there's typically a decrease in urine production. Now, if I get into parasympathetic, when everything like we realize when the dog is like, oh, it was just the mailman, or you realize it was your friend that just jumped out and scared you, when everything calms down, your heart rate is going to come down. It's going to decrease. Your heart is not going to beat as hard, okay? It's going to slow down. Your bronchioles are going to go back to normal. They're going to decrease or constrict because you shouldn't need as much air. And then your pupil will decrease. But the things that go back and start ramping up is your GI blood flow. Your motility increases again. Your skin blood vessels, you know, they don't change much. Your blood vessels to the kidney, but basically everything that was like GI motility, urine flow, all of that in the parasympathetic is going to go back to normal. Now, whenever I talk about this in class, I usually have one person ask, and if you've been in an emergency or you've been in trauma, sometimes we get a dog that's been hit by a car and all of a sudden they pee all over themselves or they defecate. Now, they probably had some urine in their bladder. They probably had some fecal matter in their colon. And obviously the clinching or the stressful event, sometimes they will pee themselves. Sometimes they will defecate after a trauma, hit by car, dog fight. That is not because all of that impulse has increased production. It's probably just something was there and that clenching of the muscles or that stressful event causes them to urinate or to defecate. So I don't want you to associate it's because there is an increase in motility or increase in urine production. It's probably something was just there and it happens. You know, dogs that seizure typically pee or defecate themselves, but that's not due to that increase in activity. So let me just type briefly in the little screen here. So know the first. So I just want you to know, if I ask you on a test, I might say, you know, what happens during a stressful event to heart rate? What happens to bronchioles when we're under parasympathetic stimulation, okay? So sympathetic fight and flight, the parasympathetic is the rest, restore, relax. Some people call it rest and digest situation. Now, we've already said there are main neurotransmitters, and the neurotransmitters are basically what is released from the nervous system to tell the blood vessels to constrict, the bronchioles to dilate. So norepinephrine is the primary neurotransmitter for the sympathetic nervous system, okay? It is released, now next term we talk about the endocrine system. So we're going to talk about the adrenal gland. The adrenal gland is near our kidneys, and it is an endocrine organ, but that is typically where norepinephrine is released from. Epinephrine is also an excitatory sympathetic neurotransmitter. So basically during stress, norepinephrine is going to be released. It's going to bind to these receptors on the blood vessels. Let me get to the next slide because I think, so remember, a neurotransmitter can only work if an area in the body has a receptor for it. So if we look at, there's 3 types of receptors, and I've taught pharmacology now, and I'm also teaching neurologic diseases and things like that. So I've talked about these in other classes. So this will come up when we get into diseases and trauma, and we talk in later classes. But there's 3 primary sympathetic nervous system receptors. You've got alpha-1 receptors, beta-1 receptors, beta-2 receptors. So what happens during stress is these catecholamines, which are basically, you know, these neurotransmitters of stress or fight and flight, they are released and they bind to the alpha-1 receptors. Well, the alpha-1 receptors are some in the GI tract, the kidney, but they typically cause vasoconstriction. Vaso is vessel, constriction is to narrow. What they do, you have blood flow that's in your kidneys, in your skin, you know, in your GI tract. When those vessels constrict, that blood is shifted to other areas of the body. So that blood is now available to, you know, the muscles, the lungs, the brain, the heart. Okay, that blood is being squeezed out and pushed somewhere else. The beta-1 receptors are found within the heart. And what that's going to do is help increase the rate of beating and how hard the heart beats. Because basically, the heart is just a big pump pushing blood to the body. If we make it beat harder and faster, we're going to hopefully pump more blood to the rest of the tissues throughout the body. The beta-2 receptors are found in our lungs, and when catecholamines or like the norepinephrine binds in the lungs, it causes those bronchioles to dilate. Okay, so that's going to cause an increase. So basically, understanding that the reason that these vessels dilate, the heart beats harder, bronchioles dilate, is because during the stressful event, norepinephrine is released and it binds to specific neurotransmitters and it causes these effects. But I want to give you an example. We have dogs that sometimes have heart disease, okay? And basically, and if somebody just popped in, because I feel like my number just went up, make sure you type here if you just got in, or you didn't type here, just do that. But let me give you an example. Dogs that are going into heart failure, congestive heart failure, we cannot make that go away, okay? That's a progressive genetic disease that sometimes happens. But what we can do for those dogs is we will typically give them what are called beta-1 agonists, okay? These drugs are going to be given in a pill form, and they're going to mimic what these neurotransmitters do in the body. So when we give the dog a pill, a beta-1 agonist, it's going to cause the heart to beat harder, and it's going to hopefully increase the heart rate. Because usually dogs in heart failure, their heart is getting weak. And what happens is the heart doesn't beat as hard, and it doesn't beat as fast. So what we're doing is we're giving a drug to try to help the heart. Now, eventually, heart disease is going to catch up. Okay, these dogs are going to, you know, eventually pass away from heart failure. But in the meantime, we're going to give a drug that's called a beta-1 agonist, and it's going to cause basically the heart to beat harder and faster. So Ireland asks, is Lasix just used to lift fluid off the heart? Yes. So Lasix is a drug which is called a diuretic. Now the problem in heart failure or heart disease is the heart is responsible for balancing blood flow and water balance. When the heart does, one of the main clinical signs we see in heart disease, sometimes you get coughing, you get fluid in the lungs, or fluid in the abdomen. And it's because the heart is not beating properly. And the problem is water balance, it builds up in the tissue. So you get like edema. So Lasix is a drug that, yes, it's called a diuretic. It'll cause that excess fluid to be pushed to the kidneys, and typically they will urinate more. Anytime, I will tell you, we get into these drugs a little bit later when you get into pharmacology and diseases, but anytime I send an owner home with Lasix, we can give it via injection, we can give it via pill. I tell them that dog's going to have to go out more often than not. They have to urinate. Sometimes they have accidents in the house, and I explain to the owner, you know, it's just your dog is urinating, going to urinate more. We're forcing that water to be pushed out of the kidneys. So it's not necessarily the dog's fault. They're making more urine because we're making them make more urine. We're trying to get that water out of the body. Sometimes people talk about a water pill. A lot of times they're talking about Lasix. There's different ones, but Lasix is the primary drug. So Ireland, you are correct. You know, now Lasix, beta-1 agonists, Lasix is a diuretic, so it's not a beta agonist, but it a lot of times is used with beta-1 agonists to try to help relieve some of that fluid in the body and help relieve some pressure off the heart. So hopefully that answers the question. Now, I talked about the primary neurotransmitters of the sympathetic nervous system, but now we get into the parasympathetic system, and acetylcholine is the primary transmitter for the parasympathetic. Cholinergic neurons release acetylcholine. Do you see cholinergic? Acetylcholine. So acetylcholine is released from a cholinergic neuron. Now, there are two types of receptors that work with cholinergic neurons and acetylcholine. There's nicotinic and muscarinic. So nicotinic receptors are found in two places. Acetylcholine is the primary neurotransmitter for muscle contraction. So your skeletal muscles work off acetylcholine. So acetylcholine is very broad. Acetylcholine will work for skeletal contraction, but it also works in the parasympathetic system. Typically, it's found on target organs that replenish or resupply. So it gets your GI system moving again. It gets saliva to be produced. I'll give you another pharmacology connection. We use a drug in veterinary medicine called atropine. Atropine is what's called an anticholinergic, okay? We often give it to anesthesia patients because when we give anesthetics, they cause drooling, sometimes they cause nausea, they cause vomiting, and a lot of anesthetics decrease heart rate. So when we give atropine, we are doing things that go against the cholinergic system. So atropine dries up secretions, it slows GI motility, it increases heart rate. It's anticholinergic. So again, you're going to hear a lot of this come back up when you do pharmacology, when we talk about cardiac diseases, when we talk about anesthesia. We'll get into these receptors. So having an understanding of how these receptors and these neurotransmitters work normally will make a lot more sense when you take pharmacology and you talk about diseases and how we use drugs to manipulate these natural things in the body, okay? So acetylcholine, I just want you to know, is the primary neurotransmitter for the parasympathetic system. And this is a little chart. So you have the autonomic system, you have sympathetic, parasympathetic. Sympathetic, the primary neurotransmitter is norepinephrine, epinephrine as well, but that's the primary. It binds to the adrenergic receptors, which are the alpha-1 receptors are found in the vessels. Beta-1 receptors are found in the heart, and beta-2 receptors are found in the bronchioles. So in fight and flight, you're going to get effects here. When we have parasympathetic, which is the opposite, Acetylcholine's the primary neurotransmitter, binds to cholinergic receptors, which are nicotinic and muscarinic, and those are going to cause, you know, GI motility to increase, salivary secretions to increase. It's going to get GI motility going again, urine production going again. Okay. Now, hang on one second. I'm skipping a few of these slides. We're not going to talk about, well, let me just mention something about reflexes, because I get into these a little, we get into nervous system diseases, but we talk about a reflex as a rapid automatic stimulus response to stimuli, okay? If you go to the doctor and they take that little orange little hammer and they hit your knee and you kick, you basically, they're trying to hit your nerve, and you're basically supposed to have a reflex response. Let me give you another example. I talk about the palpebral reflex. When we have a dog under anesthesia, and sometimes you guys watch surgery, sometimes you're going to see them tap the inner corner of the eye. Obviously, if someone comes at your eye, you should blink, okay? It's protective. So most reflexes in the body are designed to be protective. The cough reflex. When we go to intubate a dog for anesthesia, if they're not asleep enough, you go to try to pass the tube into their trachea, a lot of times they will close their epiglottis and their laryngeal folds and they'll cough. The cough reflex is protective. It's designed to not allow things in the airway. So anytime we're going to talk about cough reflex, swallow reflex, palpebral reflex, the femoral nerve reflex, all of those reflexes are designed to protect. So I just want you to know from this slide that a reflex is an automatic response to a stimulus, and it is protective. Okay, the blink reflex is protective. Now, I'm not going to get into the reflex arc, okay? Yes, and a lot of times, like what Ireland's saying is the cough is the only way to tube a cat. Now, a lot of times, you know, the opening to the esophagus is right behind the epiglottis. So it's very hard during intubation because it's very easy to see the opening to the trachea, and sometimes the tube slips behind and goes into the esophagus. But if you pass an endotracheal tube and then the dog coughs as you're passing it, it's one way to know, or the cat, it's one way to know we're going in the right spot. Because if you're passing a tube and they cough, that's typically a good sign because you're in the right spot. I don't always get a cough during intubation. If your dog is very asleep, then we don't typically see that cough reflex. Okay, so it's not essential. It depends on how deep, and we'll talk about that when we do anesthesia and we talk about intubation. It's like we talk about how do we know, but I do want you to know that, you know, a reflex is designed to be automatic and it's designed to protect the body. I'm not going to talk about the moderation of reflexes, but I do want to talk about a stretch reflex. You're fine. So hopefully, Michaela, you're in now. So, okay. And, okay, so basically what is happening here, so sorry, somebody was trying to message me. I'm going to talk about in the body, this is showing you a muscle, but basically there is the lungs are, the lungs are basically organs that stretch and contract, and they stretch and contract. The stomach stretches. Any organ like bladder, stomach, lungs basically has receptors, and as it gets to its capacity, it's going to send a signal, okay? And what they're showing is the muscle that's stretching is going to send a signal to the brain. the brain is now going to send an inhibitory response, and basically then that muscle triggers contraction. So when we inhale and we exhale, I talk about that next term when we do the respiratory system, is basically there's stretch receptors that are sensing that the lungs have stretched. Then they initiate an inhibitory signals and the lungs contract. So you get inhalation, exhalation, inhalation, exhalation. And it's designed to monitor stretching. The bladder, that's why all of a sudden, like your bladder, everybody's bladder right now is filling. TMI. But you know, all of a sudden right now, urine is constantly being produced. All of a sudden, you get this urge, you're like, I gotta go to the bathroom. What's happening is your bladder is reaching capacity. A stretch receptor says bladder is full, goes to the brain sends a signal and starts contracting the bladder muscles. That is all autonomic. Now, there is a muscle around your urethra, which is called the urethral sphincter. The urethral sphincter is under voluntary control. So if your dog is holding it or you are holding it, you have control of that sphincter. But what's basically happening is you are getting squeezing of the muscle because the stretch receptor has detected that that organ is kind of at capacity, okay? So that's kind of what a stretch reflex is. I'm not gonna get in, well, let me talk about the withdrawal reflex. Now, I just did neurologic diseases with my other class, ClinMed 4. We were talking about how to do a neurologic exam. Now, if we have a dog and we suspect disc disease, even a brain issue, even, you know, Ireland's case that she was talking about, when a dog goes into a neurologic service, they're trying to figure out where is the problem. Is it at the brain? Is it the nerves? Is it the spinal cord? What they're going to do is going to test withdrawal reflex. The main time we do this is when we suspect. So a paw flip is called a postural reflex. When you bend a dog's paw and then it tries, we want it to right its paw. You basically want to put it in the right spot. That's called a postural reflex, which is posture. But what we do in a withdrawal reflex is this is when we pinch the toes, okay? If I take a clamp and clamp a dog's toe, I expect them to withdraw their paw, okay? Because it hurts. That's protective, okay? If I have a dog that has a disc that's putting pressure on a nerve, sometimes you'll sit there and pinch the toe and it won't go like, you know, it won't do it or it's delayed. Now, I will tell you, I've done a lot of anesthesia. I've been an anesthesia tech, and that's my primary area of expertise. A lot of times I have a dog on the table and they're laying there under anesthesia, and I will sit there and pinch their little toe web, okay? If Dr. Ritz is getting ready to come in and do surgery, okay, and I'm sitting here and I'm pinching their toe and they're going like this, do you think they're going to be ready for surgery? If they can feel me do that, they're certainly going to feel the doctor cutting open their abdomen, if that makes sense. So a lot of times I have a dog on the table, I will just sit there during surgery periodically and I will pinch that little web in between their toe. And what I'm looking for is withdrawal. And it helps me determine how deep my dog is, okay? I don't, you know, if we're getting ready to do surgery, I don't want to see a withdrawal. But if I'm getting ready to wake the dog up from anesthesia, I want them to be able to detect this. This tells me that the dog is waking up, if that makes sense. So I will talk about the withdrawal reflex in neurologic diseases. I talk about the reflex in anesthesia, because it's all about how we monitor the consciousness level of our patient. But what's happening in here is a receptor picks up a pinch, and this shows a little nail, anything painful, it picks it up, sends a signal to the brain. The brain is going to send an efferent signal to the muscles. It causes those muscles to flex or withdraw. That's all this slide is basically saying, okay? I'm not going to talk, you don't need to know the cross extensor reflex. That's like a contralateral response. But basically the reflexes that I want you to know is what am I looking for with the withdrawal reflex? And then the palpebral, this is where you tap. This is the medial canthus. This is the lateral canthus. This is lateral, this is medial. When you tap here, you should get a blink. So palpebral. The other reflex we look for is what's called a PLR, and students get these two mixed up. Palpebral is looking for a blink. If I ask you on a test, what am I assessing for when I tap the medial canthus of the eye? You would tell me I'm assessing a palpebral reflex and I'm looking for a blink, okay? If I say, what am I looking for a PLR? PLRs are pupillary light reflexes, okay? If you've ever been to an ophthalmologist, the room is dark, and then they come around. Normally when the room is dark, your pupils dilate to accommodate and bring in as much light as possible. If someone comes around with a bright light and shines it, your pupils should constrict, okay? That's the normal response to bright light. The other eye should do the same thing, okay? Shining a light in here should cause this light. This is what's called direct and consensual. That means that with a direct light, you get a consensual response. It means both are doing the same. It is very abnormal if you shine a light in their eye as big like a saucer. That's a test of brain function. Okay, what we're looking at is the brain's ability to control the pupil. Okay, this is not trying to tell me if the dog is blind. This is only telling me, can the brain control the pupil? So it's a test of brain function. If we have a dog that's head trauma, brain tumor, if I have a really bad surgery, sometimes I will do this during surgery on my anesthesia patients if I'm really concerned. If I see pupils that look like saucers, okay, that tells me the brain is not controlling that pupil. And it could be a sign that we've got a severe brain injury. So that's what I'm looking for. Shoot, let me go back a second. So just to, and DTP, Ireland, what did you mean by DTP? Sorry, yes. Okay. In this lecture, I'm not getting into superficial and deep pain, but what Ireland's saying, when we get into the neurologic system diseases, you do that in ClinMed 4. You talk about diseases. Sometimes when I pinch here between the toe, that is more superficial pain because this is skin, okay? That little webbing between their toe, that's more superficial. If I want to test for deep pain, which is the deeper neurons, we will take a clamp and actually clamp, and we're mostly pushing on the bone. You're going to get some superficial response because there's skin, but deep tissue pain or deep pain is we will really clamp the toe. A lot of times, sometimes I'll pinch in between the web. If I'm really concerned about a patient, if I'm worried they're too deep or we're potentially going into arrest, I will get a clamp and try to clamp their toe. That's a deeper response. But there are diseases that affect superficial pain, and there's diseases that affect deep pain. Obviously, if an animal has no deep pain, oh yeah, right, I feel bad. There's nothing worse than clamping a dog's toe. I've seen doctors clamp, and the dog is literally just sitting there. Then there's somewhere in that pathway, they're either not detecting it or they've detected it and they can't send the signal back to withdraw the paw. So then we know, then the doctor can help decide what nerves are affected, how much of the nerves are being affected in that situation. So let me back up a little bit. When we get into these last slides, I want you to understand the transmitters, okay, and how they affect which ones on the chart. For reflexes, I only want you to know that it's an automatic response to stimuli. You don't have to know the reflex arc or moderation. I just want you to understand the stretch reflex, withdrawal reflex, palpebral, and PLR. Yeah, if they can't withdraw the penis and that nerve, that can be very detrimental to the patient. Okay, I see that I went up a participant. So if somebody did not put here, make sure you put here in the chat if you joined me. I need to see that you're here because somebody just entered. Okay, thank you. Let me see if I can put up the, let me do this. Hold on, let's see if I can pull up. And I'm trying to pull up. Aha, but I'm trying to get it over here. Can you see that on my other screen? Oh, Ireland, that's hilarious. Okay, we need that sometimes happens though. If they can't withdraw the penis, that nerve can be affected. But you meant dachshund. Yes, there's nothing like that. That's pretty terrible. Can you guys see this homework sheet that I have pulled up here? Okay. Now, obviously, hang on one second. You're already leaving? But are you going to work on your AP test? Yeah. Okay. Okay. Sorry. Okay. Let me, was there any big questions on here? Will the majority of this be on our, I know it's a stupid question, but I know. There's a lot of material. This was a little more expensive, or extensive, not expensive. I'm kind of going through, so if I go through, obviously knowing the parts of a neuron, okay? Be familiar with all of the parts. If there was if I explained what's the dendrite, what is the axon, if I can get a picture of a neuron and the image of the spinal cord, you may have to identify parts of the neuron. The one thing I want to mention about a neuron is I stressed where the signal came in is the dendrites. The axon of the neuron is where the signal leaves the neuron, okay? That's where it comes in. So you need to know dendrites and axons, number 4. Number 5, it's just there's the myelin sheath and the little gap is the node of Ranvier. So the node of Ranvier is where depolarization moves. You need to know number 6. Number 7, you have afferent nerves are typically sensory, efferent are typically motor. Okay, so that's the main difference there. For number 8, A is your somatic. Somatic is always conscious control. B, C, D, E are all autonomic which is your sympathetic and parasympathetic. So only A was conscious control or conscious number 9, which is talking about depolarization, and it says what ion. Remember when I talked about this in class, I wanted you to know during resting state, depolarization and repolarization. Resting state is where the potassium is inside, sodium is outside. That's the ions we're talking about. We're talking about sodium and potassium. When a nerve is stimulated, that is depolarization, and that's when sodium rushes in. So now inside the cell, you have high sodium, high potassium. When you have repolarization, potassium moves out. Now the cell has repolarized, except they had switched spots, okay? So you have, I want you to know where sodium and potassium are during resting state, depolarization, repolarization. Okay, I'm not sure, Mackenzie, why you didn't receive, this was sent when I sent the homework. Hopefully, did anyone else not receive this? But this was sent when I sent the homework last week. I can resend this to you. Okay. Resting state, for 12, you don't need to know number 12. You don't need to know threshold. You don't need to know number 13. 14, remember, myelin always sends things faster. Myelinated axons, it's like an insulator. So it helps the signal go faster. So that is faster. You don't need to know 15. You don't need to know 16. You know what I'll do, since I know you guys probably have math soon? Let me go through this assignment and I will send you an email and tell you which numbers to know. Did anybody have, oh, for number 23, I did not have you know the cranial nerves. I just wanted you to know there's 12 cranial nerves. They are Roman numerals. They are not 1, 2, 3, 4, 5. They would be the Roman symbols. That's how they're listed. But you didn't need to know the cranial nerves. So what I think I will do is I will go through and tell you which of these questions you need to know. In the email, I'm also going to send you the key to the lab exercises. I'm going to pull up one thing. Can you guys still see my screen? Okay. There is a website. I'm going to pull it up. And it is called Purpose Games, okay? So if you can all see this screen, it is called Purpose Games. They have a bunch of educational games. If you go to this little search box up here, okay, I type in veterinary, because the problem is if you just type in the heart or the bone, or they're going to bring up a lot of human anatomy games. Some of it applies, but I always type in veterinary. If you look here, these are all different games about veterinary systems. So when we do the bones, there is a skull or there is a skeleton, and you can go in and play. I'm going to try to find, there was one. Now, some are good games and some are not great. Usually, like, let me give you an example. It'll tell you how many times the game has been played. the higher the number of plays, usually the better the image is. Sometimes you'll see one that has 10 plays, okay? Anybody can go on here and make a purpose game. So there's ones that are better than others. I'm trying to find, let me just type in, hang on. Okay, parts of a neuron. This has 21,000 plays. Can everybody see this still? Okay. So here is a neuron. Hopefully you can still see this on my screen. Okay. If you go in and I hit play, right up here it says axon. Okay. There's blue dots. You're going to click on the proper blue dot. If I click on it, oh, they call that a node. Okay. So that's the axon. The nucleus. The soma, which is the cell body, which is the perikaryon, is right there. Terminal boutons are down here. The dendrites are up here. Now the node of Ranvier is down here. The myelin sheath is this little thing right here. Okay, now it gives me a scorecard. So, and you can play again. So let's play it again. Now, say for example, axon. Okay, I'm gonna hit, nope, it's not that. Nope, it's not that. Nope, it's not that. Okay, if you keep hitting the wrong thing, do you see how the dot now turns pink? Can you guys see that? If someone could type if they see that or not when I'm playing, thank you. Okay, if you basically keep screwing up, it's going to eventually be like, okay, it's right here. Now, do you see how that dot is red? You can go back and see that, okay, that's one that I didn't know. You can play this over and over again. So I will send you this link, but you can use this purpose games. I was going to send this to you for the bones for sure, but I remembered there was probably a neuron. So you might want to play this so that you're able to label a neuron. But I'm going to send you an email that tells you which numbers from the study guide to know. I'm going to send an email with the answers to the lab homework, and then I will send you this link. Actually, let me just finish this out. Somewhere like this. Okay. So again, you can do this as many times as you want. It's a good little site. Are there any other questions that you want to type a question to me in the chat? When I'm done here, like I said, I'm going to go through all my emails. Yes. Yes. If you have individual questions and you want to email me, go ahead and do that. So I can go through and answer any questions that you might have. But the email will explain which questions from the study guide and which pictures that I want you to be able to identify. I will open the quiz at the same time I always do. I will give the 3-hour, I've extended my window to the 3-hour window, but remember, you have about 75 minutes to take the test. You have to start it before, 75 minutes before it ends, or it will stop you. If you have a 3-hour window, there should be plenty of time to take the test. If you have questions and you want to email me directly, please do. I will be checking the homework. And if not, I'm going to